So in this webinar, we're going to be explaining about the call for submissions, about the equitable access to play for children in the north of England. And we're going to be talking about the themes within the submission, how you can submit a contribution, and I'll also I'll sort of introduce it a little bit, but then I'm going to be handing over to the leaders of each of the different themes so that they can explain those in a bit more detail. And then following this, we're planning to have about 20 minutes Q&A session at the end. So if you do have any questions, are you able to just put those in the chat? And then we can come around to those. We'll try and answer as many as possible, but if we don't get through them all, we'll probably just do like a FAQ sheet and send that around afterwards. We're also joined here today by Sarah Wilson, who is a really experienced play worker and coordinator of the Sheffield Play Partnership. And Sarah's going to be helping with the Q&A and the sort of tech as well. So to introduce what the report's about, the idea came from the fact that in 2025 we saw quite a bit of movement in the area of play and policy at the national level. So there was Play England that launched its national 10-year sort of play strategy. The all-party parliamentary group on play was established, and Raising the Nation Play Commission was also published. So we can see some movement already happening on the basis of this kind of energy that was formed in 2025. So there's the government's investment in playgrounds, there's commitment to enrichment activities and more funding for extracurricular activities, things like that. So it is quite a pivotal moment, but we do need to keep making the case for play and making sure that play is firmly on the agenda as well throughout all of this. So this report is a Child of the North report, so hence why it's focusing on children in the northern region of England. And Child of the North, just to explain, is a collaboration between the N8, which are like the most research intensive N8 universities in the north of England, and also Health Equity North. So together, Child of the North sort of aims to translate evidence into transformative impact to improve the outcomes for children living in the north of England, and to tackle complex, deep-rooted issues that affect children. There's also an all-party parliamentary group for Child of the North, so that brings together MPs from different parties. So we're going to be sharing this report with them at the end of it, and hopefully, with Andy Burnham looking like he's going to be leading the country soon and championing the North, there's quite a lot of energy, potential for change. So that's all very exciting. But we're also hoping to present the report to the APPG on play as well, and we're in discussion with Play England about that at the moment. The report is also a collaboration with the Centre for Young Lives, who did the Play Commission, the Raising the Nation Play Commission last year. And so what they did was they brought a huge amount of evidence together around why children need to play, why play is important, what some of the barriers are to play, and the fact that children have less opportunities to play than previous generations. So that was all really, really important work. And they sort of made all these recommendations with the overarching kind of message that play urgently needs to be restored into every child's life. And achieving this requires play to become political and policy priority. So through this work, what we're trying to do is build on the foundation that the Play Commission laid in 2025. So the Play Commission included lots of powerful case studies that show innovative schemes and strategies and programs that support children's right to play, even in quite challenging contexts. But that was quite a small segment of the Raising the Nation Play Commission. So what we want to do is sort of really expand this case studies and this stories aspect of the Play report, the Play Commission. So in this report, we're going to continue that thread, and we're hoping to hear from people working and volunteering in a really wide range of settings who protect and promote opportunities for children to play in the north of England. So the structure of our report with the 6 themes that we've come up with are actually sort of based on Raising the Nation's 6 themes. And so we've used these, we've adapted them slightly. So each theme in the report is going to be led by sort of experts in the field, who you will be meeting some of in a moment. They'll be speaking about each of the themes. So we also acknowledge that actually play is sort of very intersecting in nature, and it's difficult to kind of separate out the different elements, because combined all these different themes lead to children being able to play. But that is sort of why we're encouraging, if it's appropriate, submissions to kind of indicate which theme you might fit under, but also you can select more than one theme if that is more relevant to your work, because very often that is the case, and that's absolutely fine as well. So what we're looking for submissions from everyone and anyone who supports children to play more, essentially anyone who sort of intentionally incorporates play into their work or their volunteering or any spaces. So it could be teachers and teaching assistants, parents, health practitioners, hospital staff, volunteers, policy actors, HAF providers, play workers, anyone that's involved in this space really. And the sorts of settings as well, like really broad. We're not looking for people who are specifically in adventure playgrounds and sort of play schemes. It could also be beyond that, sort of any use of parks, museums, libraries, sports clubs, town centres, schools, hospitals and hospices, sort of prisons and youth detention centres, hotels for asylum seekers, and obviously like street space as well, anything that's happening on doorsteps. That list could be endless. So really, sort of thinking very, very, very broadly about play happening everywhere and being the responsibility of everybody, and it's not just sort of specifically for play workers in play work settings, if that makes sense. We also welcome submissions from contributors who are not sort of place-based. So, for example, digital play opportunities aren't necessarily linked to a geographical location, but they would impact children in the North's ability to sort of have these play opportunities as well. So how to submit? We've got two formats for submission. One is to complete the sort of Google form, writing 400 words about your work. So we've given sort of a list, an indicative list of the things you might want to include. So the context of your activities, what you do, what kind of broader area your work is situated within, such as health or education, what impact your activities have, especially if you have any examples of youth voice. We're really interested in any examples of systems change that you've achieved, such as policy, planning, governance, partnerships, anything that sort of enabled you to create conditions for play at scale, and any sort of barriers that you encounter. And then finally, something we're very, very keen to hear about is, for the purposes of thinking about recommendations that we could make, we'd like to hear about anything that you need or would like, ideally in a perfect world, to help your activities to continue and to flourish. And that would really help us to sort of make some strong recommendations for actual tangible things that could be done to make positive changes. So if writing isn't your thing, that's fine, because we have an alternative submission format. So you can fill in your details in the oral submission Google form, and Sarah Wilson will contact you to arrange a time for a chat, and Sarah will write the summary for you. So if that's more accessible for anybody or just easier, then please take advantage of that as well. And through this, basically, we're hoping to collect a wide range of case studies and stories of people supporting play. And what we're going to do as an editorial team is read through these, draw out the main themes and ideas that are coming through these stories, and we will look really carefully for these sort of policy recommendations. And what we're really kind of aware of is that there's a massive amount of work, amazing work that's taking place right now on the ground, but very often that's kind of overlooked. And so when all these policymakers and decision makers are having these debates and these discussions, we want to make sure that they're informed by the work that is already happening. So we're going to try and make this sort of really visible to strengthen the case for why play needs to be explicitly addressed in policy. So I'm going to hand over to the sort of leads of each of the themes. So we'll begin with Liz Chesworth and Louise Kay, and unfortunately Yinka Oshola's not here today, but she's also leading the theme. And the theme is that they're going to be leading on is play in children and young people's lives and learning. So is that all right if I hand over to you?
Yeah, thanks, Christina. So unfortunately, Liz can't be here, so she sent me some notes that I'm going to have to read out, I'm afraid. But my work, so I've got a primary school background. I was a primary school teacher for 12 years, and 7 of those were spent in the nursery. So my work focuses on early childhood education, and I look at how policy in the early years impacts on teachers and children, with a specific focus on school readiness. And I'm aware that not all colleagues will probably be familiar with the early years context in England. So the importance of the school readiness agenda is, well, the school readiness of children is assessed at the end of the reception year through the foundation stage profile. And this is measured through a construct called the good level of development. So there are 7 areas of learning in the early years foundation stage, and if children meet 5 of those areas of learning, which include maths and literacy, physical development, communication and language, and personal, social and emotional development, they are said to have met the good level of development. And this is a high stakes assessment, so it is reported to the government and the data is shared publicly. The government also have a target of children that they want to achieve the good level of development, which has gone up recently, or the proposal is to go up to 75%. It currently sits around 69% of children achieve the good level of development at the end of reception, which is how the government measures school readiness. But they want to increase this to 75% of children. So each year we have 30% of children who don't achieve the good level of development, which is problematic. I'm not going to dwell on that at this point. But the importance, I think, of the good level of development in terms of play is the fact that the requirement to get children to reach this point does have a direct impact on teachers' pedagogical decision making. So I'm sure many of you are familiar with the fact that we have a traditionally play-based approach to early childhood education. However, what we are seeing in some reception and also some nursery classrooms is that play is being squeezed out because of the requirement to meet these outcomes. So children get the GLD, the good level of development. The outcome that children find most difficult is literacy, in particular writing. So we do see a shift in more formal teaching activities to ensure that children are reaching that outcome. So there's a concern that play has been squeezed out of early years. There's a few problems around the fact that our children start school at a very young age. We have one of the youngest school starting ages in the world. It is a compulsory school starting age of 5, but the reality for most children is 4 years old because of the September intake. So some of these children are being assessed against the GLD when they are still 4 years old because of the time that takes place in June. And they're obviously not at the compulsory school starting age. And what this does, it positions the children who don't achieve the good level of development in an already deficit position before they move in to year 1. We can see from the data that there are specific groups of children that are less likely to achieve the good level of development. For example, children on free school meals, SEN children, summer-born children. No, from my research in the reception classroom, I did my research in a few years ago. The teachers anecdotally, they told me that the children, that interventions are being put into place in reception classrooms to ensure that children, like phonics and writing, and that usually takes place in the time where children are allowed to choose what they do, what they do.
Sorry. One more minute, because otherwise we won't be able to get through everybody's.
Yeah, no, that's fine. I'm aware. Thanks, Christina. And so children are pulled out to do interventions at the time that they would be having that free choice and that free play. The other issue is the gap between the reception curriculum, the early years foundation stage, and the national curriculum. So that's the kind of problem space. Liz's work focuses more on the acts of resistance in terms of protecting play in a reception classroom. So we know that there are examples where practitioners are finding creative ways to protect and promote children's opportunities to play, even within these challenging policy contexts. And what we want to do is we want to make those stories visible of where practitioners are able to find the spaces to protect play, to ensure that children are getting that play provision in the reception classroom and in the nursery classroom. So we're looking for case studies of where that's actually happening, so we can kind of, be proud of the practice that is still going on in those spaces despite the policy challenges. And that's me.
Thank you so much. Yeah, really important work. Thank you. So moving on to the next theme is spaces to play, and this is Mick Martin and Paul Brindley who's going to be speaking on this for us.
Hi everybody, so I'm Michael Martin from the School of Geography and Planning at the University of Sheffield, and together with Professor Alison Stenning, who can't be here unfortunately at Newcastle University, and Dr. Paul Brindley from Sheffield, we are leading on the Spaces to Play area of the Equitable Access to Play report. I think just a little bit of background before I go into the theme in more detail. We know that access to opportunities for play are crucial to support children's holistic development in terms of social, cognitive, developmental, and physical indicators, and a range of other aspects. And we also know that the design of the built environment is crucial to support that, and it can have positive and negative impacts on children's opportunities for play, and then in tandem, their health and well-being. We are, as Christina rightly highlighted, seeing an increased recognition of the importance of designing and planning for children and young people and play in both formal and informal spaces across our kind of towns and cities, which is great. But we do know that there are substantial inequalities that exist for children growing up in poorer communities, and particularly in the north of England, being the most disadvantaged. So our University of Sheffield research, myself and Paul, has shown that children in deprived settlements, particularly in the north of England, have fewer, smaller and further away playground spaces, those formal play provisions that are so critical to so many people. It's the last kind of free access of play provision. So it's a significant social justice issue that has to be tackled and engaged with. We also know that children's play is impacted by a range of physical, social and legal controls that restrict their opportunities for play across the built environment. So cars, traffic, parking always take priority by comparison to children's play. No ball game signs are common in different areas. Austerity has impacted provision in terms of adventure playgrounds, youth clubs and various other settings have had to either close or reduce their hours. And public spaces then often restrict children with specific rules and regulations about what's legitimate and illegitimate uses of space. So we are hoping to turn the tide on all of that stuff by collecting case studies of really positive accounts and affirmative actions of different approaches and initiatives and strategies that support children's everyday opportunities to play. And so the Spaces to Play section, really our goal is to celebrate the dynamic activities that are happening, that people are doing to bolster children's play in a range of different spaces. So that includes formal play spaces and provisions and informal play spaces and provisions across the built environment. So parks, open spaces, the immediate doorstep and street, the neighborhood, public space, natural green areas, active travel, children's independent mobility. It might be a walking bus. And it's about trying to find those different examples. But we're really keen in particular, though, that we learn about projects that speak to inequality, that try to address challenges in access to play in relation to deprivation, disability, inclusion, marginalization, and underserved communities more broadly. And it might be different things. It might be play on the high street. It might be a policy or strategy to bolster play, such as play sufficiency that you're trying to grapple with and you're working with. Could be a street closure for play, a walking bus, as I said. Could be a project that you're doing that seeks to enable play. You haven't actually done it yet, but the goal and the intention is there. That's absolutely fine and valid. Anything around planning or governance or partnerships or strategies that enable children's opportunities for play, we're interested to hear about. And anything that's related to children's independent mobility or active travel, scooting, cycling, different bits and pieces. Anything that's child-led or youth-led, we're really keen to hear about that. Essentially, we're really keen to hear about anything that might be relevant. So if you have a story or case study or anything, please do consider submitting it. Obviously, we're really keen that they are based in the north of England, and we would love to hear about those in particular. But from our perspective, don't stress over it, just chuck it in. Thanks.
Thank you so much, Michael. So the next theme, I'm actually going to speak about it because, unfortunately, I'm co-editing this with Dr. Naomi Lott, and it's about time and right to play, but unfortunately Naomi's unwell, so I'm going to sort of speak about it a little bit. But basically, play, this is something that I'm sure many of us in the room will know about, is enshrined as a right for children in the United Nations Convention on Rights of a Child. And the premise of the UNCRC is that children are born with the same fundamental rights as all human beings, and these rights sort of are protected, and there's duties such as the obligation that state parties need to sort of guarantee that these rights, or the obligation to respect and refrain from interfering directly or indirectly with the enjoyment of these rights, the obligation to protect, requiring the governments to take steps to prevent third parties from interfering. So there's all these sorts of rights kind of language around it. And importantly, the obligation to fulfill, which requires governments to introduce necessary legislative and administrative and budgetary and other measures aimed at delivering the full enjoyment of these rights. So in particular, with relation to play, Article 31 enshrines children's right to play and the right to engage in other recreational activities. So it's really sort of important that we remember that this isn't just a nice to have. We know all the benefits of play, but we also need to remember that this is actually kind of a rights-based thing as well. So I think for me, something that's very, very interesting to pay attention to is general comment number 17 from the United Nations, which is sort of speaking around Article 31. And among other things, it provides a series of actions which are required in order to fully realize these rights. And it says that children's play is any behavior that's activity or process initiated, controlled, and structured by the children themselves. So it really emphasizes this kind of child-led, child-created, child-initiated activities that are driven by intrinsic motivation and undertaken for their own sake. So I just think that's a really important thing to remember, this sort of general comment 17. And also it goes on to say that caregivers may contribute to the creation of environments in which play takes place. So sort of having supportive environments that enable playful opportunities. So the thing with this right is that while play is often considered as kind of non-essential, having this enshrined means that it reaffirms that it's actually a fundamental and vital dimension of the pleasure of childhood, as well as an essential component of physical, social, cognitive, emotional, and spiritual development. So it's, it is essential, it's vital, it has to be given sort of priority, protection, respect, and there is an obligation to fulfill this sort of duty towards making sure that children have opportunities to play. Very often we see there's many barriers, such as society's indifference to the importance of play, overemphasis on learning, as we've heard Louise talk about, increased number of children living in sort of inadequate provisions of play, and inadequate environmental planning, as we just heard Michael speak about. There's also an overemphasis on healthy kind of competition and activities that drive this competitive nature, winning at all costs. And there's less focus on these kind of play for play's sake activities. So within this theme, we'd really like to hear from anyone that's kind of taking this rights-based approach to play and has that kind of driving their work. So it could be introducing play in settings that are not originally conceived of as environments designated for play. So challenging dominant sort of negative perceptions of play, for example, such as quite often play can be considered or conflated with antisocial behavior, especially with older children, for example, or transforming kind of structured status quo practices in institutions to ensure that children's right to play is upheld, such as reclaiming streets as play spaces, or in schools and in any other sort of institutional context. So anything that kind of uses rights as a vehicle for understanding why children need to play in a range of settings. We're really, really keen to hear. I'm going to pass on to Wendy Russell and Jill Thompson, who are going to be leading the play, wellbeing and health strand for us.
Thanks, Christina, and hello. My background is kind of generically in play, and I've just done a bit of a review on the relationship between play and health and well-being. And I'm working with Hannah and Jill, and they're the health experts, health and well-being experts in this kind of little editorial team for this section. I think everybody's already talked about how much play underpins health and well-being. The thing for me about health and well-being is when everyone talks about how play helps development, that's kind of future focused. and health and well-being can be right here, right now, and will include some of the things that we don't necessarily think about. So things like joy, and the benefits of joy for preventing depression. There's, neuroscientific evidence that if you're happy, then you're less likely to become depressed, and play makes children happy when it works for them. That the kind of the joy and vitality that arises from nonsense, basically, or from playing with strong emotions like disgust or fear. That sort of this kind of stuff that some adults don't like, and might try and control. So I think there's some of the things that get missed out when we talk about how play is good for children's physical, mental, all that kind of stuff. And the other thing I'd like to say is that playing is a way of participating in everyday life. And it's how children build connections to other children, to other adults, to place, to things, special toys, that sort of thing. And we know that there's all sorts of barriers. Everyone else has spoken about that. So the playing out barriers in schools in terms of time and space, but particularly health inequalities comes into this section specifically, I think. So children living in poverty, in poor housing, in temporary accommodation, and children in healthcare settings as well. So I think they're the kind of specialist bits. But I think it's also a hoover up section. So if you can't find anywhere else to put what you want, it's bound to fit in health and well-being, because that's what play does. And so the kinds of interventions, big, small, anything really. A lot has already been mentioned. This is where some community projects that maybe work in specific contexts, so prisons, women's refuges, temporary accommodation, but also healthcare settings, that sort of thing. And I think, Jill, do you want to say something particular about healthcare settings or the health aspect of stuff?
Yeah, thanks, Wendy. Yeah, so in terms of healthcare settings, I mean, I do lots of work with the Children's Hospital, so you might want to be looking specifically at interventions that have been put into place to encourage play in hospital settings, or mental health settings. So I've done some work around community gardens, for example, and looking at how children interact in green spaces in more sort of formal healthcare settings. Or you might have some projects that are with specific healthcare conditions, and looking at sort of barriers and facilitators to engaging children in play or providing opportunities for play for particular conditions where sometimes access to play might be limited or more tricky or more challenging. But as Wendy says, it is very much a sort of a theme that kind of intersects with all the themes. So we know that, we will have there'll definitely be some sort of crossover there. I think that's everything for our theme. Thank you.
Thank you so much, Wendy and Jill. So moving on to the next theme is digital play. So that's going to be spoken about by Fiona Scott and Angela Colbert.
Thanks so much, Christina. I hope everybody can hear me. Yeah. We're Fiona Scott and Angela Colbert, two academics at the University of Sheffield who specialise in the digital lives of children. And we're leading the part of the call that focuses on digital play.
So digital play is often problematised, but does hold benefits to children, both in relation to learning, but also their well-being.
So a good example of that, my recent work on the project called RITEC, Responsible Innovation in Technology for Children. This is research I delivered with UNICEF and the LEGO Foundation. It was international research which showed that well-designed digital play can support 8 dimensions of well-being: relationships, creativity, emotions, autonomy, competence, identity, diversity, equity, inclusion, and safety and security. My past research with LEGO, so things like children, technology and play, have also showed how children learn things like subject knowledge and understanding, digital skills and holistic skills through their digital play.
And I worked with the Digital Futures Commission in the UK, who brought together industry, politicians, academics and civil society to explore how children's rights to play, free play, should and could be upheld in the digital world across both physical and digital spaces. This research explored how playful possibilities for children's self-led play are shaped by people, products and places, the environment. The principles that emerged, called Playful by Design, called for spaces to be welcoming, enhance imagination, enable open-ended play, avoid commercial exploitation, ensure safety, allow for experimentation, as well as being age appropriate, including supporting intergenerational play. My most recent work has explored how these principles have been enacted and integrated into design practices by small and large international companies.
So while play can support learning, and so often the focus is on development, children's self-chosen and self-led digital play can also be really important for their well-being. As Wendy said, that includes valuing children's joyful experiences in the here and now. As with any play, there are also risks, but we would argue that an overemphasis on those risks itself risks removing access to one of the most enjoyable and self-led opportunities for children to access play. Children have a right to play, including digitally.
So digital play isn't instead of non-digital play, but it is an important space. And we want to emphasise and call for submissions that illustrate how people and organisations are supporting the safe, equitable digital play for children that's supportive of learning and or well-being and or self-led play.
So in terms of some of the greatest barriers at the moment, we would say one of the biggest is the polarised landscape. So at the moment, parents, educators and policymakers hear very different and conflicting messages about digital play, ultimately making it hard to know how to make good decisions.
And from a design perspective, we need safe, imaginative, accessible, welcoming, engaging and exciting spaces to be designed for children so that they're able to engage in this self-led digital play in ways that support their well-being and uphold their right to play in these digital environments, as outlined in the General Comment 25 of the United Nations Rights of the Child that was mentioned earlier.
So to give one example, a really nice example that came out of our research of what this could look like in practice, although we really don't want to be overly prescriptive, one of our participants was engaged with a charity in Sheffield called Sparkle, who support children and young people with autism spectrum conditions and social communication difficulties. So Sparkle set up a Minecraft server for neurodivergent children. And in our RITEC research, we saw how important that was in terms of offering a safe space for neurodivergent children to play, particularly supporting social connection, autonomy and creativity.
So our call is multi-stakeholder, and the question we ask to those who are responding is, are you a digital designer who's developing opportunities for children to engage in meaningful play through design choices? Are you an educator, a community group or charity who tries to integrate digital play into your work with children and young people? Or a policymaker who is designing to support this across settings? So we're keen to hear about the challenges as well as the opportunities and successes so that we can really start to understand those and present them in the report.
So really, we want to hear from anyone who incorporates digital play in their work. Submissions could be practice examples, research projects or policy case studies. Thank you.
Thanks.
Thanks very much, both. And then finally, I'm going to hand over to Paige Davis. Unfortunately, Gil Francis can't join us today, but yeah, Paige is going to be speaking about the theme of parents and play.
Yeah, hi everyone. Gil and I had a little meeting on Tuesday and fleshed out exactly what we wanted to convey to you. She's sadly at her daughter's wedding, so or happily. So how this started for me with the parents and play is just simply because I became a parent and realized that sometimes I wasn't as supported as I could have been in my play. And I ended up working with Theatre Hullabaloo in Darlington to look at a program that was play on prescription. It's the first socially prescribed play program in England. And I brought my second child to the sessions, and my second child was only 1.5 at that point. So I actually not only got to evaluate this program, but I got to really be in it five times compared to one per day. But yeah, and for me, this parenting and play then has a really particularly personal angle to it, because it just became one of the things that I really like to look at and research, and was able to research specifically this program and play. So, and as you all know, play is the most powerful way children can socialize, communicate, regulate emotions, and even in infancy, which is what this program that I was working with to evaluate, we know that this is something that's a really powerful way to connect with children. And this is not just for neurotypical children either, it's for neurodivergent children as well. So, and any child. Parents are their children's first play partner. So being able as a parent to witness and shape these building blocks of play in infancy, and going on to have this front row seat when children begin to show signs of play around 18 months, that's a really important part of play. So we think this is an important area. We also know that some parents feel capable and supported in playing with their child, but many parents, like I felt like there were structural barriers or inequalities that meant it was more difficult for them to play with their children. So for example, I had just come over really to the UK and didn't know where to go or what to do. And being an immigrant's hard sometimes. And but there are other structural barriers as well. And they can include things like psychological stress. And this is particularly for parents in disadvantaged circumstances, living with financial constraints, in poor housing conditions, and yeah, so those are some of the barriers that parents may experience. So we came up with 4 different things that we wanted to find answers for in our case studies that are being submitted. So the first thing is, what is the landscape in the UK of play? And that's pertaining to parenthood in specific. So we want to know what it looks like. Well, not in the UK, but rather in the north of England. But how are parents navigating these playful opportunities that they share with their children? So, any observations on how this is happening or how this is being made to happen? What are the ways that groups, schools, organizations, settings make it easier to empower parents to create space to play, to access support, and to continue their journey? And finally, what are the varying levels of support around knowledge, confidence, social attitudes, and thought around parents and play? So in terms of what your case studies could include, and this is not an exhaustive list, so just consider this. It could be formal or informal, or these incidental interventions that parents receive. Strategies or activities for parents and children might be something that you might want to submit. Cases in infancy, early, middle, late childhood, or even adolescence would be welcome. Settings could be anything from nurseries, early years, primary school, secondary school, special education. I actually reached out to a swimming school that I knew because they do some great play in their swimming, especially for children that might not have the opportunity to swim. And then community or out of school activities. And parents could also include that, this is not, it could be carers, adoptive, foster, young parents, any type of parent or carer. And then children could have special educational needs, disabilities, or have lower socioeconomic status. We're looking for diverse families. We're looking for whatever type of family that you might have. And that's all.
Thank you so much, Paige. That's great. Thank you. So yeah, thanks to everybody for sharing a little bit of insight around the different themes. So now what I'd like to do is open up the chat for questions. So if anybody has any questions that they'd like clarifying, I can see that Michael's put the link again for the actual call for submissions in response to a question from Rob. So yeah, are there any questions that we haven't covered so far? I think the main point for me to reiterate is that we're obviously trying to be as inclusive as possible, welcome case studies from everybody, but to remind everyone as well that there's two formats of submission. You can either write 400 words or you can just put your details in, and Sarah Wilson will be able to give you a call and arrange a time to chat instead if that's more convenient for you.